Thanks to ISOT, thanks to chairperson, respected chairpersons, and all the audience. I'll be presenting on the reforms for augmenting deceased organ donation in India. I'll just show the statistics. Though we say we have these kind of demands every year for transplant, but this is our waiting list that we have around 70,000 people waiting for various organ transplants which are registered with the NOTO, basically NOTO, and this is compiled from the states. So 70,000 people around waiting for the transplants in the country, and last year we have done total of 17,168 transplants, and this is the breakup that you can see. This is 2022 comparison of 10 best countries which have done highest number of transplants in the world. So India stands at number 3, but again the issue you can see that our proportion of the deceased organ donation, that is cadaver transplant, which is in the green bar, is green grayish bar, is very low. It is the lowest among all these 10 countries, and our living donor number is the highest among these countries. So we are doing number 1 in living donor transplants in the world, and third in the total number. This is our organ donation rate, again 2022 data, because 23 it is yet to be published on the GODT website. And our organ donation rate per million population still continues to be below 1 per million population, while the highest in the world goes up to 47. Total, how it has progressed over the year, total number of organ transplants. And these are the graphs which show how the deceased as well as living donor transplants over the years have progressed. So, like living donor last year was 14,200. So number of persons who donated in a year. So last year we crossed more than 1,000. That was again a effort of like states and everybody who is involved, the entire transplant community, I will say. So we could cross more than 1,000 donations last year. So, and these are the 5 states which are highest. We have Telangana, Karnataka, Tamil Nadu, Maharashtra and Gujarat. And then followed by these others also, which did highest number of deceased organ donation in the country. We still have red areas where no deceased donation activity has taken place in the country. These are the red states which are shown in the red color. But there are states like you can see the western and the southern part of the country where the deceased organ donation is is happening maximum, and it is expanding also. But our worry is that somewhere where it has initiated but not expanding, which is the creamish areas. So those cream areas, they initiated the transplant, did 1 or 2, and then they are not expanding. So that is real worry in those areas. If you look at the infrastructure wise in the government and private sector, 854 transplants, 854 centers which are linked with the NOTO. So only 15% around are in the government sector, in the public sector. Like in kidney, out of 582 centers which are linked with NOTO, 73 are in public sector and 509 are in government sector. Similarly, in the NTORC, this percentage is a little higher in government sector, but still around 33 only, like in kidney, we have in government sectors which are NTORCs. NTORC is non-transplant organ retrieval centers. So this is the cycle that you all are aware of, that how it happens in a hospital. We have in a ICU settings, donor is detected and donor is then suspected to be a brain dead person and suspected by the intensivist who is working over there, and then if they suspect and find him to a potential donor, some maintenance protocol is put in place, brainstem death diagnosis is done, then family consent, and the information has to go to the respective SOTO who will organize the distribution of these donated organs. So main challenges we have these, because these steps that I showed, these are the steps where the main challenges we face. We have less number of brainstem death certification. We have reporting of the data. I showed you only 70,000 are waiting as per the national registry. And infrastructure availability, which is especially in government sector, all potential recipients are not being considered for registration. And establishing a sustainable program, because they do one or two and then some kind of inertia develops. So that is also, we have other challenges also that we'll discuss. You are aware of these timelines within these. So disease donation whenever happens has to be organized within these timelines. We are trying to organize our systems. We have a system of registering the patients through the hospital. All these hospitals, like 854 that I showed, they have a user ID and password which has been allotted by NOTO, and patients can be registered by these hospitals with the NOTO, and then after registration they are given a unique NOTO ID, the patient, and that ID is applicable all over the country. Patient has a right to change the hospital whenever they want. And they have to, and the process is very simple. And whenever a donor is there, deceased donor, so that donor has to be basically also given a ID whenever he donates. So one donor will donate many organs. As you can see, like on an average, we see that they donate 3 organs per person. And then the allocation is done first within the hospital, then within the state, then within the region. We have regional organizations. So this is how right now every state which has an active transplant activity or an organ retrieval activity, they have a supporting organization from the central government side in that state. We are running a national organ transplant program to support these organizations, as well as to give grants for establishing new centers and upgradation of the existing centers, and to provide transplant coordinators and post-transplant immunosuppressant therapies at the rate of 10,000 per month to the BPL patients. And these grants are given through the respective SOTOs. And for dignified funeral of the deceased donor, also 10,000 per deceased person is also given. And maintenance of the deceased donor whenever one organ is coming to a government institution, so that is also there. So certain recent reforms I'll be talking about only in respect, because we are right now facing some living donor issues also, but I will not be talking on the living donor issues, only the deceased donation. Post-mortem basically can be taken up on priority and can be conducted even after sunset if adequate infrastructure is available. That kind of a circular has been issued from the ministry side. We have circulated that one nation, one policy, in which a patient can go to any state and get himself registered for receiving a deceased donor organ. That state domicile condition has been removed, and person of any age can register, because if he requires a organ transplant. So earlier there was a age bar of registration of 65 years. No fee can be charged for registering the patient for receiving a deceased organ donation. We have written to medical NMC basically for including in the MBBS curriculum, and that has been done already by them. And we have also written to the CBSC, not the CBSE, sorry, Ministry of HRD, Ministry of Human Resource Development, for including in the school. And we are told that there is an action already started over there, and we'll try to follow up with them when it gets to get it expedited. We are working also for coordinating with the pre-hospital care and trauma care, so as to have viable donors reaching the hospitals in time, and basically so that their organs can be harvested. We have defined a uniform organ transport policy. Now at every airport we have a nodal officer to facilitate organ transport identified, and then we are like already implemented no screening of the organ box, and SOTO will coordinate all these transport through the airport wherever it is required, and metro rules were also amended to allow transport of organs through the metro railways. We are now already a letter has gone from DGHS. We want to every organ donation as well as transplantation to be reported to the national registry. So tracking of every donor and recipient, like that NOTO ID that we have given, I just now mentioned, and for every transplant that is happening in the country, if it is happening without the NOTO ID, I think we are going to consider it as illegal, and every recipient as well as donor, whether deceased or living donor, they need to have a NOTO ID, and that should be because so that it gets automatically included in the registry. Then disease donation is to be promoted by all the transplant centers. You know, some of them will say, we will do only living, we will not do deceased. So that is not the case. They have to do deceased as well. It is desirable that every transplant hospital, whether public or private, promotes deceased donation and strives to achieve a minimum number of donations annually. So that is one thing that we have categorically informed, and letter has gone from the Secretary Health to all the states, and they will be required to establish a system for brainstem death certification as well as its monitoring and facility, and provide the facility for deceased organ donation maintenance, because every transplant hospital is automatically authorized to do organ retrieval. So, but they have to provide facilities for, deceased organ donation to happen in their hospital. So, an advisory has already been issued, and we are following up with the states. Then, reinforcement of the brainstem death certification as well as its audit. We are again and again writing to the states, and we have also devised a performa. We will improve the performa if it is required with the help of our intensivist, and that has gone, and a required request board, it needs to be displayed, because we have our legal provision that there is a required request, because every potential donor, family of the potential donor needs to be inquired about, and a request is to be made. So that is also is to be displayed. Then there was a provision of advisory committee, but most of these advisory committees were not constituted, so we have already requested states to constitute. Then training, capacity building, and basically we are advocating for, that is very important, because dedicated transplant unit in the medical colleges, multi-organ transplant centers, retrieval facilities in the medical colleges, to be organ retrieval to be part of the PG general surgery curriculum, SOPs to be updated and defined, and these brainstem death training, as well as we realize that even cornea retrieval trainings need to be put in place. During the last year we have done, awareness activities we have been doing, but we have reformed to ensure the outreach of the awareness activities through the Angdan Mahotsav, Naman Divas, Seva Pakhwada. Organ donation was part of all these, Viksit Bharat Yatra, Ayushman Bhav initiative, and campaigns which were organized through the fairs, health melas, e-newsletters, involvement of NGOs, social media campaigns. So we are trying to reach even the villages, and that reach has increased. To give a digital pledge registry has been launched, which is Aadhaar authenticated, and it is also linked to your ABHA ID, and legally sound, patient's family is informed, NGOs or motivators name is also included, and there is an option of unpledging also if one desires to unpledge. This is basically for developing India as a developed country. This plan we are preparing, in which I'm just sharing it, it is just a proposal that every medical college, so we are trying to have in all the government medical colleges the retrieval facility, And so 350 retrieval centers we are trying to establish in next 5 years. 50 kidney transplant centers, these are the budgets I have indicated, and 10 new liver transplant centers, and also legal reforms, whatever is required to be done to facilitate deceased donation. We had done a legal symposium where many of you were present. Some of the recommendations are there, like one of them was opt-out system can initially be implemented for the corneal donation, single window clearance through noto for certain activities, statutory power to the noto, inclusion of brainstem death in the definition of death, and cell xenotransplantation and body donation to be also included under the Act. So basically, this is the, for the want of the time, I'll skip the video, but this is basically we are promoting pledging of the for organ donation by all the citizens of the country. That is already, you can go through the website that I displayed. So thank you so much. Yeah.